I'll kick it off. Tell us the situation going on with COVID-19 and pediatrics in the Children's Hospital right now.
As many of you have had the opportunity to see the latest surge numbers that we have seen a continuous slow rise of pediatric admissions to the hospital secondary to COVID-19 infections. Currently, we have 22 patients in-house. Helen DeVos Children's Hospital is a 240-bed, fully comprehensive children's hospital. So by default, 1/10 of our patients currently are admitted for COVID-19. Half of those patients, 11, are currently in our ICU. These patients range from anywhere from under 1 up to 17 years of age. And we have continuously seen an increased rise in the number of patients that we see on a daily basis. We've seen everything from just the simple respiratory all the way to the multi-system inflammatory disease. We have had a significant increase in those patients also, where we're seeing about 4 to 5 of them per day, while prior to this latest surge, we did not see those kinds of numbers.
Given that it's an all-time high, what does that tell you as a doctor about the situation of the Omicron variant in our community?
Sure. During the first, I would say, 3 waves with Delta and the other variants, we did not see the significant impact on the pediatric population. That has definitely changed with Omicron. What we, as pediatricians, myself being one, we highly recommend parents to continue to do all that they can do, families, grandparents, schools, to continue to do everything they can to protect their children. And that specifically goes back to getting vaccinated and making sure that all the other precautions are taken with masking, hand washing, social distancing, all of those things, because we're seeing an increase in the number of patients under 5 years of age who cannot get vaccinated, also coming down with Omicron and having not only the symptoms, but some of them being admitted to the hospital. So the only thing they can do as a defense is to have everybody else do what they can do to help prevent it.
I mean, you kind of already mentioned this. Hi, I'm Danielle Salisbury from MLI. I hope I'm not interrupting you, Andrea. I just wondered, I mean, you kind of mentioned vaccinations. I mean, what are some of the reasons you think? I mean, if you look at the adult hospitalizations, they haven't risen to the same degree.
Sure.
I mean, why do you think, what are some of the reasons you think that the pediatric patients are increasing like this?
One of the things that we have seen with the Omicron variant is that it is significantly more infectious and easier spread amongst people than any of the other variants or the original strain. That in itself has created more opportunity for people that maybe not even feel that they have any symptoms to have the virus and be shedding it and having other people become infected by it. So that's part of it. And I think we've, again, with children, because of the close proximity in everything that they do, gives them more opportunity to be exposed to a more infectious version, the Omicron, and therefore having the symptoms that prior versions did not do because of all the other precautions that we took, and also the slower infectivity, also the ability to be able to diagnose a patient before they were shedding the virus to others. So I think all of those combined has created this environment now where we are seeing a significant increase in the number of younger patients who are being admitted to the hospital with symptoms.
And are these patients mostly, we hear a lot right now about hospitalized with COVID versus hospitalized for COVID. Can you distinguish, or I mean, how are these patients presenting?
We can, and most of the patients that we have admitted to the hospital are patients who are suffering from symptoms directly due to COVID infection, respiratory symptoms, or having that multi-inflammatory system disease that is affecting them. So they're not just admitted because coincidentally we found that they're actually being admitted for symptoms directly related to the infection that they're having.
Okay. I mean, I think there's this general idea that COVID is not as severe for children. And usually I think that's true, right? I mean, the numbers are still pretty low. And when you compare it to adults, I mean, how would you respond to somebody making that sort of argument?
You know, I think I've heard that argument in multiple different areas, and I would ask people to think a bit differently. Children can't protect themselves. We're their advocates. As a pediatrician, that's why I do what I do, which is to advocate for children. So if they cannot be vaccinated, if they cannot have the ability to do some of the precautions that we can take as adults to be able to avoid getting infected, then it's our responsibility to do that. And this recent rise actually goes to show that they're not immune to it. They are going to get that. And what is the life of a child worth? We have a child that has, is infected with COVID and ends up in an ICU, such as the 11 that I mentioned. Is that really worth the risk that we want to take as responsible adults? So I think I would just turn that discussion a little bit differently and say, how do we help protect our youngest children that can't protect themselves? Because we have seen some as under even 1 year of age who have been exposed and are presenting and are having to be admitted to the hospital, and they have no way of being able to protect themselves.
And going off Danielle's question there, sorry, Aaron Parsegian from Fox 17 here, doctor. Thank you for your time. Going off Danielle's question there, so I think when viewers of ours see these numbers, they don't think much of it. They just are kind of immune to seeing numbers of COVID cases. Can you speak to the condition of some of these kids that you're seeing in the hospital directly related to them contracting COVID?
Sure. So the presentation of a COVID infection can be everything from simple cold symptoms, a fever, all the way to, unfortunately, death. And you never know which child is going to be the one that has the simple cold symptoms and which one is the unfortunate one that's going to necessarily get the multi-system inflammatory syndrome or maybe even progress to death. So that's where we can't take any risk and any chance with any patient, because we don't know who's going to be responding. So that's why it's so important to be able to take precautions across the board. And I totally understand. I believe now we are in 20 plus months of dealing with this global pandemic, and many of us are tired, including many of the healthcare workers that have continuously been there to take care of patients. But I think that's why it's so much more important that now that this disease has turned more toward our kids, even more opportunity for us to be responsible and be able to care for them and provide the services for them to keep them safe. So I would, again, ask people to take a look at it and say, what is the life of even one child worth if we have the opportunity to be able to get vaccinated, to wash our hands, to do some of the precautions that we can put into effect. How good would that be to be able to hopefully get past this without any child having to suffer from any kind of illness due to Omicron or any of the variants?
How are the outcomes usually? I mean, I know you've said they vary. I mean, kids are pretty resilient, right? I mean, the deaths among children are very low. I mean, how do these such cases usually resolve? Please.
Many of the children that do get exposed to COVID-19 virus, be it the original, the Delta variant, or now the Omicron, have mild symptoms, which is great. That's what we hope for. We hope that this is another cold virus that can cause the same things that we've always dealt with for many, many years and took care of previously without any issues. But unfortunately, we don't know which ones are going to actually turn for the worst. So again, we're glad that many kids that do have this virus or become exposed to it do very well. I want to make sure that I emphasize that they do very well. But on the other end of the spectrum, I wish there was a way we could tell who is not, so we can address that faster. But unfortunately, we do not. So by default, we're asking to take precautions all across the board.
Thank you. I mean, this is a pretty busy time, I think, for pediatrics in general, this time of the year, right? I mean, with cold and flu and various viruses. I mean, how is the situation in general in the Children's Hospital? Is it full? What's the strain on the hospitals now? Please.
Yes, obviously wintertime has historically been one of the busiest times for the Children's Hospital because of all the different respiratory infections that causes kids to be admitted to the hospital. Interestingly, as I mentioned, that we've had the increase in the number of COVID patients, we have not seen the usual increase in admission numbers for other things that we have seen in the past, like respiratory syncytial virus or for the flu. We are seeing very few patients that are presenting with flu, very few patients that are presenting with respiratory syncytial virus or any other viruses that usually admitted them. So this probably the past 2 years has been very different from what historically we've been used to. Now, that still does not mean that we have a change that has created this environment. I think, again, when you look at what Omicron has done, it has slowly replaced a lot of those, where hopefully last year, with all the precautions that were in place, we did not see the flu admissions. We did not see the RSV admissions because people took the precautions, because kids did wear masks and they were separate from each other. Many of them still, even in school, was done remotely, or if in school, they did it with masking. And that truly changed the way that the kids were getting sick. They were not, which is great. Now, as we see a little bit more laxed opportunity for kids to go back to some of the things that they did, and as well as some of the opportunities for Omicron to be much more effective, that's what we're seeing, and that's what's getting admitted now, not as much what we used to see with other viruses.
While I'm thinking about it, Mara, do you
Doctor,
want
it's
to
Luke
share
from Wood
what
TV.
Yeah.
A couple of questions. I know it was a few weeks ago we reported there had been one pediatric death so far, I believe, from COVID at DeVos Children's. Do you know if that number has changed?
I am not 100% certain of that. I believe that not any longer correct.
Okay.
That
We
there are
can
more
check
than
on,
that.
we can check on that for you, Lou.
Yeah.
Thank you very much, Andrea.
Yep.
And then I guess with numbers, you know, the way that they are right now with you guys at this high, what would be your suggestion to parents about what steps their kids should be taking? I mean, a lot of schools no longer have mask mandates. I mean, I guess what would just be your advice to parents in the area right now?
My advice as a pediatrician and also as a parent of two young boys myself who are in school would be to go back to what the American Academy of Pediatrics has recommended all along, which is for all adults that can and have the opportunity to be vaccinated and to continue to do a lot of the work that they do in regards to precautions. Same thing with children. We very much recommend the opportunity to be able to vaccinate children now 5 and older. But that still leaves a large population under 5 years of age that really depend on their parents, their grandparents, their caretakers, their teachers, everybody else to continue to do the great work that they do to help protect them so they do not get this virus. So my recommendation is what has been all along is to take all the precautions that you can. If you can get vaccinated, please get vaccinated. If you can wear a mask and you can do all the things that are asked, please continue to do that, especially as you are around younger children who cannot do that for themselves.
And then just a question about the 11 kids who are in the ICU. I mean, that number really jumped out at me. I mean, kind of a little bit more about the condition of patients, you know, of these kids who are in the ICU right now and kind of what they're going through.
Well, obviously, just by the sheer fact that they are in the intensive care unit should give you some semblance of the care that they're needed and the challenges that they have. Because if they were doing well, as we talked about, many kids might have regular symptoms such as cold symptoms, but this is beyond that. When we talk about respiratory infections that are severely causing a child to have ability to breathe on their own, or when you have children that are suffering from multi-system failure due to this infection, then that requires that high level of care in the intensive care unit. So that's why, again, my emphasis on we don't know which one is going to be the next one, the 12th one that's going to come into our ICU. So that's why it's so important for us to make sure that we care for our kids as much to avoid this infection, and when they do, to really take care to make sure they do well and they don't spread it to anybody else. So it is I'm very proud of our teams, of our physicians, our nurses, our respiratory therapists, everybody on that ICU floor, because they take wonderful care of these kids, and hopefully everybody will come back and do better after this infection is done. But again, it's always the unknown.
All right. Thank you very much for taking my questions and for all the work your team is doing.
Of course. Thank you.
Any other questions for Dr. Marandi?
This is Danielle again from MLive. If no, I don't want to hog all the questions, but I just thought of something.
Please.
Thank you again. I mean, I think you said you never know who it could be. I mean, do some of these kids have pre-existing conditions? I mean, do you see both?
Yes. Yes, I think one of the things that we have seen across the time that we have dealt with COVID is that having pre-existing conditions definitely makes it more difficult to be able to address this, and especially if those conditions involve any kind of a respiratory issue. So yes, we have seen that both on the adult and the pediatric side. What's sometimes we're unable to be able to tell is a child that could be completely healthy and have no other medical conditions that all of a sudden starts to have those. And that's where, as I mentioned, the unknown is what creates this inability to be able to discern which one is going to be the one that's going to be end up in the ICU, that might start off as a simple cold, but progress to more respiratory failure and end up in that area. But definitely having more complex medical issues associated with it puts you in a more difficult situation. And that's why, again, we have recommended that all of our kids that attend many of our complex care clinics, children that have pre-existing conditions, that we have very much recommended those children to get vaccinated as soon as they can, if they can, because we have seen that it protects them. To give you an example, over the last 20 plus months that we've had admissions to the hospital, we had 478 patients admitted. Half of those have been admitted in the past 4 months. And only 11 of those had full vaccination, the 2 series. So again, we know vaccinations work even in kids, especially in kids. So that's why we very much recommend vaccinations for adults and kids that can have the vaccinations.
Yeah, I mean, unfortunately, the numbers are pretty low for kids. I know that they've been eligible for a lot shorter period, but it seems like the uptake has been slow in vaccinations for those youngest age groups.
It has. You're absolutely correct. When you look at national numbers, we have seen a very slow rise on the number of patients. Obviously, 12 and older were first and had the opportunity to get that. 5 to 11 was next, but we have not seen as greater numbers as we would expect to be able to help protect them. So again, which is what falls back on us as adults. If we cannot get them vaccinated as far as pediatric patients, or they are unable to, then it falls that much more on us to be able to be vaccinated to protect them from getting it.
Thank you.
Of course.
Any other questions for Dr. Marandi? Going once? Going twice?
I guess if there's anything else you'd like to share, Doctor, about the situation, anything that we didn't ask you?
No, I just wanted to thank each and every one of you for taking the time to bring attention to this. I wanted to thank all of the children's hospitals, both in the state of Michigan as well as nationally, who have been on the front lines taking care of many, many patients. We are here to take care of pediatric patients. This is what we do. This is what we're good at, and we will always be there to support our communities and our patients and our families to be able to be healthy and to be safe. We just ask to please do what you can do to help us keep those kids safe. Our job is to advocate for them. And again, we hope, as myself, as in my role, and many other people in my role across the nation in the children's hospitals, we have signed and that we want to do this care. We want to be on the front lines and advocate for everyone to please keep our kids safe, because we need you. We need you to be vaccinated. We need you to protect them. And in the case that you need us, we're always there to be able to take care of them.